All right, so in this video, we're gonna be talking especially for runners. If you're dealing with IT band symptoms, if you're having issues from your knee all the way up to your hip, there's one specific reason why that's happening. We wanna explain why. So Connie here is gonna demonstrate a simple thing that you can be doing at home as well, and that's simply just doing a single leg stance. So what we're gonna have her do is just stand on her right leg, and then she's gonna stand on her left leg. And what we see that's different from her right versus her left is that when she comes back down and she raises her left leg again, she's keeping good stance of her hip on this side. Now when she goes and raises the other leg, we see that she drops a little bit on that left hip, and that her trunk or her pelvis shifts a little bit towards the left side. And the reasoning for that is when she brings this leg down, is that when she goes to lift her right leg, she's not actually loading her hip, she's loading her quad. And when that happens, it's the same thing as what we talked about with squatting in our video about squatting and IT band syndrome, is the fact that if you're loading this quad tissue first, you're gonna get much more hip flexor activation. You're not gonna get that glute that's gonna help stabilize and provide that good stability of your hip going from flexion all the way to extension with your running mechanics. And as you do that, for mileage and distance and time, you find that that's when that tissue gets tighter, that's when that tissue gets more irritated, and that's why you're feeling symptoms after you're done with your run. That's why you're feeling symptoms when you wake up in the morning, and because of the fact that these muscles just aren't turning off. So how do we fix this? One of the biggest things is simply to learn how to keep your big toe on the ground and keep your butt engaged. So we're gonna have Connie squeeze her left butt cheek right now. And then as she lifts her right leg up, we see that she stands a little bit taller. She feels more tension in your left hip, right? So as she's doing that, she's getting more tension in her left hip. She's learning to use more of that hip versus using the quad. And as she goes in and does her workouts and does her running, she's finding that the more she does that, the more her system recognizes how to do that. So it's an easy tip, an easy identification to a fault that we see most common with runners that are dealing with IT band symptoms, and an easy way to fix that by making sure you keep your big toe and you're keeping your butt engaged while you run to make sure that your mechanics are sound and are going to help you stay healthy and running pain-free. So give that a shot and let us know if you have any questions.